Dr. Thomas Ellsworth here. Many older adults take a simple pill to sleep better, relieve allergies, or control cramps. What few imagine is that this same medicine may be silently affecting the brain. A recent study linked continuous use of these medications to brain shrinkage and a dementia risk that can increase by up to 50%. Today I'm going to show you exactly how this happens and which ones are the most dangerous. Imagine this. You take a medicine that seems completely harmless. Maybe it's for motion sickness on a car trip, maybe for spring allergies, or even to help relax your muscles after a long day. At first you feel relief, but over months or years, something subtle starts to change. Your memory isn't as sharp as before. Concentration becomes harder. It feels like a thin fog has settled in your head. Many people blame this on normal aging, but science is showing that it's not always just age. These medications belong to a class called anticholinergics. They work by blocking the action of a very important neurotransmitter called acetylcholine. Think of acetylcholine as the chemical messenger that helps the brain form new memories, maintain focus, and even coordinate smooth movements. When you block this messenger repeatedly, the brain starts to miss it. Over time, this can generate inflammation and contribute to the buildup of beta amyloid plaques, the protein strongly linked to Alzheimer's. Other mechanisms also come into play, such as changes in the brain's blood vessels, increasing the risk of vascular dementia. The most worrying part is that many of these drugs are used daily by millions of people here in the United States. Some are even sold without a prescription, and the danger doesn't come from just one medicine alone. When you take more than one medication with anticholinergic effects, the risk multiplies. This is what specialists call polypharmacy. Have you ever felt that brain fog after taking some allergy or sleep medicine? Or maybe you've noticed you're forgetting small things more often? Drop a quick comment if this has already happened to you. And at the end of this video, I'm going to show you something many people still don't know. There is a simple scale that lets you calculate the total risk your medicines represent to your brain. But before that, let's better understand which 5 medications worry specialists the most when it comes to memory protection. Let's start with 5th place, a medicine widely prescribed to treat urinary incontinence, especially in older women. It helps control an overactive bladder, but its anticholinergic effect is strong. Many patients report dry mouth, constipation, and with prolonged use, that feeling of mental confusion that slowly settles in. In 4th place comes a very common medicine for abdominal cramps and gastrointestinal problems. It is used by people who suffer from irritable bowel or spasms. The problem is that it easily crosses the blood-brain barrier and directly interferes with acetylcholine. Those who use it frequently may notice that short-term memory doesn't work as well as before. In 3rd place, we have an entire class of older antidepressants and anxiolytics of the tricyclic type. Many doctors still prescribe these drugs for chronic pain, sleep problems, or anxiety. They are effective, but the cost to the brain can be high with continuous use. In 2nd place is a muscle relaxant that many people take after injuries or for back pain. It is widely sold and seems like a simple solution. However, its effect on the central nervous system is significant and can contribute to cognitive decline over the years. And now we reach 1st place. This one will surprise many people. It is a medicine for motion sickness and dizziness that is present in the purse or medicine cabinet of millions of Americans. Sold freely in pharmacies, considered by many as something totally safe and harmless. but studies show it has one of the highest anticholinergic burdens among commonly used medications. It is exactly this one that tops the ranking of risk to the brain. You must be wondering now, am I taking any of these? Or maybe someone in my family uses them regularly? The good news is that you don't need to stay exposed to this risk. There's a practical way to understand exactly how much each medicine is weighing on your brain. Specialists use a tool called the Anticholinergic Cognitive Burden Scale, or simply the ACB scale. Each medication receives a score from 0 to 3. The higher the number, the greater the impact on acetylcholine, and consequently on memory and long-term brain health. When we add up the score of all the medicines a person takes, the risk does not increase linearly. It grows exponentially. That is why it is so important to look at the complete picture, not just one medicine at a time. Let's continue the ranking we started. I have already shown 5th, 4th, 3rd, and 2nd place. But what draws the most attention is the first place drug, that motion sickness and dizziness medicine that so many people consider harmless. Many Americans keep a pack of it in the car, in their purse, or in the drawer at home, thinking it is something light. However, it carries a very high anticholinergic burden and may be silently contributing to the brain fog you feel today, or to more serious problems tomorrow. Now think about your medicine cabinet. How many medications do you or someone in your family take regularly? Could more than one of them have some anticholinergic effect? This sum is what really worries geriatricians. One medicine alone can already be problematic. 2 or 3 together significantly raise the risk, but take it easy. This can be adjusted. The first thing I recommend is to do a simple and honest audit of your home pharmacy. Take all the bottles and boxes you use frequently. Write down the name of each medication, then check the ACB scale to see the score for each one. Updated lists are available on reliable health websites, or you can ask your doctor or pharmacist for help. To make it easier, here are some substitutions that many specialists consider safer for the brain. For urinary incontinence, instead of oxybutynin, options with lower anticholinergic burden can be evaluated, such as certain newer medications or even non-pharmacological approaches when possible. For intestinal cramps, there are alternatives that act more locally in the digestive tract and interfere less with the central nervous system. When it comes to antidepressants or medicines for anxiety and chronic pain, more modern classes of drugs usually present lower risk to memory. It is worth talking to your doctor about the possibility of switching to options with a more favorable profile. For muscle relaxants, physical therapy, stretching, or medications with a different mechanism can often bring relief without the same brain impact. And what about that number 1 medicine for motion sickness and dizziness? There are gentler alternatives for the brain, especially for occasional use. For those who need it more frequently, the best is to seek guidance for options that do not block acetylcholine as much. The important thing is not to stop any medication on your own. Always talk to your doctor before making any change. The goal is not to eliminate everything, but to reduce the total burden whenever possible. Have you ever stopped to look at your medicine cabinet this way? Or maybe you are thinking of doing it after watching this video? Tell me in the comments if you usually review the medications you take. And at the end, I will still show you how to protect the brain more broadly, including simple habits that help preserve acetylcholine and reduce brain inflammation. Protecting the brain does not have to be complicated, but it requires attention and consistency. After doing that simple audit of your medicine cabinet, the next step is to act with intelligence and calm. Start by prioritizing the substitutions your doctor considers safe. Reducing the total anticholinergic burden makes a real difference over time. Many patients report that brain fog gradually decreases, concentration improves, and memory seems more reliable after a few weeks or months with less exposure to these medications. In addition to changing medications, there are daily habits that help preserve acetylcholine and fight inflammation in the brain. Drinking enough water throughout the day keeps the body hydrated and the brain working better. Sleeping well at night is essential because it is during deep sleep that the brain clears toxins and consolidates memories. Walking every day, even if only for 20 or 30 minutes, improves cerebral blood flow and reduces the risk of vascular problems. Keeping the mind active with reading, puzzles, conversations, or learning something new also makes all the difference. Avoiding a sedentary lifestyle and controlling conditions such as high blood pressure, diabetes, and high cholesterol protects the brain's blood vessels and decreases the chances of vascular dementia. Studies indicate that about 10% of dementia cases can be avoided when we adopt measures like these. It is not a small number. It means that practical choices made today can help preserve independence, the ability to remember important details and quality of life for many more years. Think about your parents, your grandparents, or yourself a few years from now. No one wants to reach a point where they cannot remember family stories, recognize loved ones' faces, or perform simple daily activities. This image is the strongest motivation to look carefully at the medicines we use routinely. It is an act of care for yourself and for those you love. I see cases like this frequently. People who decided to review their medications, talk to their doctor, and made careful changes. Over time, they noticed they could think more clearly, remember names and dates more easily, and even sleep better without depending so much on certain pills. It was not a magical overnight transformation, but a consistent and very valuable change. So, what are you going to do starting today? Will you set aside a moment this week to calmly review your medicine cabinet? Will you schedule a conversation with your doctor to discuss possible gentler substitutions for the brain? Or maybe you have already identified which of those 5 medications is present in your home or in someone in your family's home. Leave in the comments which medicine surprised you the most when you discovered it can affect the brain in the long term. If you have already made some exchange or similar audit, also tell how your experience was. Your stories can help other people who are watching right now. If this video brought useful and practical information to you, give it a like so more people can access this content. Share it with someone in the family or with a friend who takes medications regularly. It can be an important alert for them too. And if you are not yet subscribed to the channel, subscribe now and turn on notifications to receive the next videos about health in the third age, prevention of cognitive decline, and habits that really protect the brain. Taking care of the brain is taking care of memory, independence, and everything that makes life really worth living. Thank you for watching until the end. Take good care of yourself and make choices that protect your future.